My name is Pritish Sharma. I work as an operations analyst with the decision support team. We support pretty much all the clinical and non-clinical departments in the organization, including preparing budget reports, preparing dashboards for the clinical database. And the data includes all the clinical side of the organization, including total visits in ED or total procedures in OR, including total productivity for the department and labor costs, etc. Every time I'm working, I'm making sure that I'm aiming my job from the patient care perspective more than providing the reports for internal productivity, because I want to make sure that every patient that comes through the doors of Valleywise Health is being taken care of, is being addressed, their problems that they've shown up at the first place. When I am doing any type of reports for the patient, for any of the departments, I'm making sure that each patient was provided compassionate care, and if that patient wasn't, then we would specifically highlight those patients, and then we would try to reach out to them to find out why they were not satisfied if they weren't, and what will it take us to get their satisfaction rate at 10 on 10. I was a patient in GI. Last year I had got my endoscopy and colonoscopy done. I was having some severe GI issues. I wasn't able to put any food down. And this was just constant happening for probably a couple months until I realized that I shouldn't ignore this and I should really get this checked out. I was seen by Dr. Danlu Wang in GI. The whole team was phenomenal. Like, I had, from the time I walked in until the time my procedure was completed, I had absolutely given the most compassionate care I could. I have this rare genetic condition where my intestines fold inside each other, so they call it interceptions. It's very rare, only 2% of the adults get it, so I wasn't sure that if I should feel lucky or if I should feel unlucky. It's a condition where it kind of goes back and forth, where the intestines are opening and closing. So because they were closing inside each other, part of my intestine wasn't getting any blood supply, so they were worried that if they'll have to do a surgery to cut that part of the intestine out. But because of, again, this also shows another example of compassionate care, they were able to provide me all the medications and all the different things that I can do naturally to avoid the surgery, and I've actually incorporated all of that, and luckily I'm feeling good. The intestines are not closing inside each other. I don't have to get operated as of now. When I came here, I didn't tell anybody I was an employee, just because I wanted to see how a normal person gets a care versus if I would have told them that I was an employee, then of course it gives them the edge that, okay, we want to treat this person a little bit better because he's a part of our organization. But I kept it to myself. I did not tell I was an employee, just to see how well I get taken care of, and it was a top-notch care. Have no complaints. The doctor followed up with me a couple days later. Then the PA followed up with me a few weeks after the doctor followed up. So I had absolutely no complaints. I felt like I was in a great hands from the second I walked in to probably until now, because I'm still seeing that doctor as my follow-up, and every time I walk in here, she just makes me feel that I'm in good hands.